There we go. Here we go. So, good day, everyone. My name's Sarah Jones, leadership coach. I work in the biopharma and pharmaceutical sector, and I'm joined here today by Leigh Hope. Leigh works with Multimed, which I believe is launched this week, if I'm not mistaken. And Leigh, it's lovely to have you on here. Thanks for joining.
Thank you for having me, Sarah. Nice to be here.
That's all right. And I should say that we're both members of the Healthcare Businesswomen's Association, which is where we met, wasn't it? So,
yes.
Yeah, both
European
part of
Leadership
that
Summit last year. Yeah.
That's right. That's right. So what I'd like to do, Leigh, is get a bit of an understanding. I know we've spoken before, a bit more about Multimed, what you're here to do, your purpose, what you do. So would you like to give us an outline of Multimed?
I would love to. Maybe I'd start by just giving people an introduction to who I am and how I got to this point, really. So I've been in pharma for about 20 years. It seems like a heartbeat, but I started off as a key account manager in Northern Ireland and sort of carried the bag for a few years and then moved across to the Southeast and very quickly went into the office, found a position in marketing and knew straight away that was my spiritual home. Really just enjoyed that whole mix of marketing. I was working with Shire at the time and really enjoyed that. And sort of after that, you know, as you do, went through a couple of different companies and mostly in specialty pharma as a brand team lead, that type of role. And, you know, for anybody who's in specialty pharma, you know that you wear lots of different hats as a brand manager. So a little bit of sales team training, lots of market access, that sort of thing. So you get your hands on lots of different functions within specialty pharma. I ended up contracting for a while, and then it was around the time where companies were doing their digital transformations and found myself with a client who just had a lot of work to do, building up their sort of online ecosystem. So we were building them brand websites. We did a medical education platform with CPD. It was a device company I was working for at the time. So we built them an online pharmacy and sort of started creating all these online assets. So at the same time, advising brand teams on their brand strategy and then more towards their content strategy. So we sort of worked quite a lot with KOLs and, you know, the sort of co-creators that brand teams are working with, making lots of content. So videos, podcasts, animations, that sort of thing. And then sort of, we all know in pharma, there's this huge sort of challenge in reaching out and, you know, getting in front of our clinicians, especially since COVID and, you know, that whole dynamic has changed, the whole landscape has changed, and companies are just not able to get in front of their clinicians the way that they could before. And I think, you know, just that sort of need for, you know, a digital sort of approach and an omni-channel approach, as we all know, is sort of the, you know, the approach that most companies are taking now. And yeah, we just saw this sort of unmet need, this frustration. We're creating all this fantastic content, and actually the amount of resource that goes into it, the return on investment for companies just wasn't there because the content is fragmented. It's all over the place. So when a healthcare professional goes to find an answer to their question, you know, they might have to go to several different company websites, register, you know, go through all of that before they actually find an answer. You know, it's difficult for them to actually discover the content that they need. And that's really what Multimed was born out of. You know, we wanted to create an experience for healthcare professionals that, you know, meets their needs, that provides some value. You know, at the end of last year, there was a report coming out practically every week talking about, you know, what healthcare professionals want and need from the pharma industry in terms of treatment information, medical information. And it's quite simple. You know, in the first instance, they want things to be discoverable. They want to be able to find them. You know, they want them to be easy to sort of consume. They want them to be short form and, you know, very clear and synthesized. And, you know, they do obviously want them to be unbiased and impartial and evidence-based and all of those things. But it's the experience I think that pharma has really been struggling with, because we all know that from a legacy point of view and an organizational structure point of view, they're just not so well set up as maybe some other sectors are. So there's a lot of catching up to do, I think, with pharma, and that's why we decided that we would, do our research, and then, we're this week and we're out in the wild in the hands of HCPs. So,
yeah. So basically, if I'm an HCP, I could come to your resource and download and view lots of different types of information that I might be looking at in a therapy area. For example, if I'm in, for example, hematology, I might find on there publications or on-demand access to information I might need in a more digestible form. Is that the gist of it, Leigh?
Yes. So from the point of view of the HCP, it's a private platform. So they will log on with their GMC or their NMC registration number and be validated in real time. And I suppose I just missed out what the key thing was, where all the content is in one place. So what we're asking pharma to do, and actually patient organizations as well, and one of our charter plans is a patient organization, and multiple companies are putting all of their content in one place. So actually, if you are a hematologist, you can go on, look within your specialty, and you can find, all of the companies on there, the content that they have. And yes, what we're trying to encourage is short format, something that's sort of digestible, that they can catch, at their convenience, and that they can tune into and just consume whenever it suits them, because that's what all the research is saying that they want. We actually have done quite a bit of work with different clinician stakeholders as we've been building the platform. And one of the partners we're working with is NHS Million. And as per their name, they've got a huge following on social media, and their values are very aligned with ours. We want to be able to provide a free resource to healthcare professionals that's funded by pharma and patient organizations. And it's really important that, we're being told by the end user what it is they actually need. So we did some market research with them last year, and 94% of them told us that it would be either valuable or very valuable to have all their pharma content in one place. And that was really the stat that we sort of went with and said, okay, we have to build this thing because the demand is there.
Exactly. And I think the demands on HCPs are so much greater these days that having that digestible content and in one place is super important. I remember when I was working in pharma, so similar to you, 20 odd years in pharma and different interactions with HCPs. I was in patient advocacy and corporate affairs, but I met with HCPs, I was party to meetings, and I was quite surprised because even at the beginning of Twitter, a lot of the HCPs were actually getting their content on specific products or other information from Twitter, and were wanting that short form content. So it's great to have something that isn't Twitter, but gives them a bit more, but it's all in one place. Because I think what I was hearing, and again, this was a few years ago, is that they're just so busy. They're so overwhelmed with what they have to do that having it in one place would be super helpful. But I don't think anyone, until now, it sounds like, has really cracked the code of how to do it. So congratulations.
Thank you. And I think now, clinicians have access to so many different channels. They can go to lots and lots of different places to find the information that they need. I heard a stat not long ago, 30% of clinicians go to TikTok as part of their medical education. And that did shock me. The thing is, it's not that surprising really when you think about it, because what they want is genuine, authentic content that's actually valuable and it's coming from a trusted source. And actually a lot of these sort of clinician creators that are up and coming, they will create their own shorts on TikTok or YouTube and, these sorts of channels. And, they're hearing that from their colleagues and their peers. And, that holds so much value potentially than, pharma, where there is still that lack of trust and a healthy dose of skepticism from doctors. But, I think you look at YouTube and they're doing some great work in terms of sort of trying to stratify their health resources, with their health shelf and everything else. But actually, I think, pharma has a lot to offer here. There's so much expertise right across the whole functions within pharma, like the life cycle, whether it's from R&D or medics who know their product inside out, they know their therapy areas inside out. All the data is saying that actually HCPs, rather than seeing a salesperson or a CAM, they really do value the interactions with the MSL or the medical advisor that they see. And I think, industry has to listen to that, and they have to, just realize that the old way of a product-focused approach, where we decide internally what we think our customers need to know, and then we push that out. There's got to be a balance. They've got to be able to come to us and find great content that, doesn't already exist somewhere else, and they've got to be able to find it.
More of a pull approach. Yeah,
exactly.
Yeah, more of a pull approach. It's interesting what you're saying about TikTok, because what I'm hearing is from younger generations or people that are more early adopters of things like TikTok, or have been, is that it's now becoming like Google almost, in terms of people going on there to find information rather than using Google. So yeah, it sounds amazing. If you can replicate that and have this really great platform where HCPs can come in, there's one place and they can find what they like, is amazing. So turning now to...
I was going to say, it becomes a trusted source of authority, because the HCP can go and they can search by key opinion leader, they can search by brand, they can search by therapy area, and they know. And I think pharma really needs to sort of shout from the rooftops how stringent the checks are before anything goes out the door. And I think maybe we probably don't say enough of that whenever we're talking to the medical community. And hopefully, it really is our mission to drive the quality of content at Multimed. So when clinicians go on and view the content, they can rate it. So then it's already an assessment from their peers. So there's that voice of the customer back to the pharma industry. So then they can start to see what works. I think one of the other big trends in pharma at the moment, and one of the sort of key discussion points and challenges, is all around data. And, what data are pharma companies getting in from all of these interactions? And it's really, really difficult for them to harmonize the data that they're getting from all of these different channels and actually find something meaningful and insightful that's going to inform their content strategy, even their overall strategy. So I think, what we need to do is look for some qualitative ways to tap into, how is what we're doing as an industry changing their behavior? How is it moving them on? How is it helping them gain more knowledge? Rather than these sort of reach metrics of, we've sent this number of emails, we had this number of them opened, the click-through rates and all. You've got to be measuring what matters. So.
Yeah, 100%. And I think you're right. Yeah, I think, I agree with your point there about, unless you've worked in pharmaceuticals or biopharma, for example, people don't realise the amount of scrutiny that everything goes through, the last full stop or every comma. So I would agree with you on that point. And the whole data, how do you interrogate that data? What can you do with that data, that might help HCPs? But it sounds as though on the platform that you're running, that it's actually quite good insights for the pharma company as well. So if there's some positive reviews, that's good insights for the pharma company to really look at and think about what they're providing to the HCP community, for example, or communities.
Yeah, you just made me think of an HBA meeting I was at last week, talking of HBA earlier, in London, and there was a couple of GMs up there, both female, by the by, Takeda and Pfizer. And I thought it'd be really interesting just to go and see, what these women have got to share with, what's essentially a female audience. There were a few male allies there or whatever. There's someone on the panel, and he was saying, in terms of behaviors and what we're trying to do, it's more about sort of co-creation and collaboration than it is about competition. And I think, pharma have shown that they can come together and deliver when they do get together through COVID and everything else. And I think, rather than that sort of individualistic approach, we can learn, we can figure out what engagement trends, that are actually happening out there if we're aggregating that data across companies, and in a very sort of, integral way, and making sure that, everybody's own data is protected. We can offer that sort of aggregated view, if you like, and see what's working and what's resonating and what's landing, and, just get that sort of voice of the customer back to industry. That's the hope anyway.
Yeah, and I think somehow the way in which certain therapy areas are progressing in terms of targeted therapy, and then even more targeted therapy, that working together approach with the right checks and balances obviously is super important in terms of combinations of medications and, companies buying in smaller companies to see if there's an adjunct therapy or something else that can work. I think as healthcare progresses, that collaboration becomes more and more important. That's certainly what I'm seeing, or what I think I'm seeing, when I look at pipeline activity, etc., in some of the pharma companies. So, yeah, interesting.
Medical have been doing it for a long time. When you look at medical education, they've been giving grants to, content creators, and they collaborate across companies, or, whatever. That sort of third party element is really important for healthcare professions. You look at, there was a big EPG report came out at the end of last year, and that really did stress the importance of using third party independent sort of sources from a trustworthiness point of view when it comes to HCPs. And I think that sort of independence is really important, although that's not really borne out in the investment that we're seeing pharma companies committing to make. It feels like there's a little bit of a slip backwards, if you like, after sort of COVID, where we're maybe going back towards investing in individual company channels, So I think there's got to be a balance there.
Yeah, absolutely. And I know digital is such a broad topic, but just from your experiences at Multimed and perhaps previously, what do you see as some of the key trends in digital in pharma? Because again, it could be, when we talk about digital, it's like sustainability, isn't it? It's like ESG. It goes across. It's almost got to be a part of an organization's DNA, I think, in terms of how they look at their business strategies and activities. But what are some of the trends that you're seeing at the moment in terms of digital strategies and what pharma's doing in this arena?
It's a good question. I mean, I went to quite a few sort of omni-channel digital conferences towards the tail end of last year. And I think what was quite encouraging was that there's more discussion and there's more focus and more emphasis on knowing your audience and knowing the reality of what your customer's actually experiencing. It sort of ties back in with customer experience, but actually knowing what their reality is. It's really, really important. About 50%, I think, I've seen this from a few different sources, of healthcare professionals at the moment are feeling burnt out and they're feeling overwhelmed in their positions. We ran a webinar with EMIG last September where we brought a couple of clinicians to the table with some senior industry decision makers, and they were just talking about how their job plans are being eroded. So there's a consultant breast cancer surgeon on there, and she was telling us that their job plans are being eroded to the point where they used to have 25% of their time dedicated to learning. Now they're getting 10%. They're learning in their own time. They're doing clinics on their days off. They're writing them up on their evenings off. So there is a real sort of pressure. We all know what the junior doctors are facing. So I think knowing that reality and not just coming from a product point of view, and understanding what their pain points are. I feel like companies are starting to really, some have done it well all along, but you have to just pull that through and figure out what the right solutions are. And they might be above, and whatever they may be. I think that's really important, because personalization is another sort of area of focus. And this is the holy grail, you know, get all the data on your customer. But actually, we can't, as companies, dictate what that journey is going to be. When an HCP, taps into their laptop and says, right, we can predict a bit, or, it's not like an adoption ladder that you could have sat down with as a sales rep, 15 years ago.
Yeah.
And, you got that real talented person who's selling to needs and all that. It's very fragmented when an HCP is going on that journey to find out the information that they want before they can make the best decision for their patients. So I think you've got to just have a realistic view on how you sort of capture that engagement and think about how, you really make that experience a positive one, so that they know when they see your brand, your company, that they're not going to be sucked into the vortex of going onto their company website and, looking at 10 different pages before they find the thing that they actually want. So I suppose
it's interesting.
Yeah. I was just going to recap and say, know your audience, personalization. They're probably the key things, and then data, which we sort of touched on a little bit earlier.
Yeah, and as you were speaking, I was thinking user experience, the same as we need to look at employee experience from when an employee starts at a company all the way through to when they leave, and then possibly come back a couple of years later, that user experience. But it's quite complex, really, I guess, because of the regulations and everything that goes with it. So those are some of are there any other trends or challenges that you think are appropriate to bring forward in this area? Anything else you've observed on your travels and going to events and congresses?
I suppose the UX piece that you're talking about is important. And the experience that everybody gets, and that, I suppose, that's internal as well, because a lot of the challenges that we're also dealing with aren't just about knowing your audience and making it a great experience for them, but how do we actually do that from an internal company point of view, when from a historical sort of standpoint, we don't really have the capabilities in-house to potentially do that easily. And I think, companies are making great inroads. Maybe they're bringing creative teams in-house, or, they've got studios where they can edit content and, use modular content and reuse it and, make those sort of tweaks and changes to their organizational structure. So, sorry, what were you going to say?
No, I was just agreeing. Yeah, because it makes me think of something. Carry on. Yeah.
Well, I'm just thinking of sort of the solutions I've seen work relatively recently. So we were creating some content last year with a big company who have really streamlined their approval process. And I know this has been something that, all companies have been trying to do for a long time, but they created like a pod type structure around a project, which really meant that everybody who was going to be involved in delivering that piece of work was involved throughout. So from the inception to the meetings with the KOL who was making the content, to being present at the recording, which, is not always a given in pharma. Unbelievably, when you think of the resource that's going into making these pieces of content, and then further down the line into how do we actually get it in front of our audience? How do we disseminate it? How do we measure whether the objective that we actually set is being hit? And actually, to have that sort of mastermind throughout the process sped things up enormously, and really created a very collaborative piece of work. So it can be done, and it does make a difference to the way things were done before.
Yeah, absolutely. It's interesting you're talking about the internal piece, because in my coaching journey, I've worked with quite a number of digital leaders in pharmaceutical companies, and sometimes some of the common complaints that I hear from them, or the frustrations I should say, is that my boss doesn't actually understand digital, and because they don't understand digital, they're not interested. That they haven't always, some leaders haven't actually grasped what digital is and what digital can do. So what I spend a lot of time doing is working with digital leaders, directors, for example, to really get that share of voice, to really press home the digital message, because as you said, it's almost at a stage now, and I think it is in some companies, but not all, where digital has to be part of the DNA going across the organization, so that if you're looking at different areas such as, I don't know, even patient advocacy, patient engagement, market access, regulatory, commercialization, that there are strategies that are embedded throughout different strategies across the departments. And some of the digital leaders I've been working with, we talk a lot about agility, flexibility. You hear these kinds of words in digital, but actually it's also about that internal influencing, managing upwards, in terms of getting that share of voice for digital, demonstrating what digital can do, really building across the different functions, across the DNA of the organization, to make sure that's understood. So that influencing as a digital leader is still super important. And I can speak to that, not because I've been a digital leader, but because I was in a functional area of, for many, many years, patient advocacy, government affairs, communications. And it's very easy to look at those functions and think, well, what's the point of that? Well, the point of that is, if you've got relationships with governments, you will avoid making mistakes in terms of your commercial strategy that completely contradicts government strategy. If you're working in patient advocacy and engagement, you're looking at your clinical trial design and taking in that feedback to make sure the endpoints meet what patients need. And throughout that journey, you're looking at digital applications that can really help the patient. So I've seen it happening in some areas, but not all, and not as much as I would like to see, because I just hear that from my clients, as in, my boss doesn't really seem to show an interest in digital because they don't understand it. So we work on that influencing across the organization. I don't know if you see that sometimes in the work you
all
do.
the time. I think whenever we're trying to find the right people to talk to in companies, it's not necessarily about their job title. It's about whether they have the will and the skills to champion a digital project, because it's all about expectation management, isn't it? Whenever you're talking to your leadership, and yes, pharma is not in the same position as it used to be when you think about all of the rebates and the reimbursements that are now being, required. And I think, it's a different timeline than it used to be. So it's difficult to, I suppose, measure what your return on investment is in the short term with a lot of digital projects. And I think, it's really important that across the organization, no matter what the function, we realize that there's a lot of testing and learning that's involved when you're putting together a digital project. And return on engagement is potentially a better way to sort of measure that type of activity. It's very difficult. You go to these meetings and you hear the omni-channel global people talking about how they're, measuring, the impact of what their teams are actually doing out there. And it's net promoter scores, it's, customer satisfaction. But actually, is that driving behavior change whenever you're talking about someone using your product? These are the sorts of discussions that really have to be had, I think, between the people who are trying to drive that change and maybe the people that you're describing who maybe, are just used to a more traditional approach. So
I think having that clear vision of what digital means to an organization is really important. Having that, I know some organizations have chief digital officers, but I'm not sure how many there are now, but maybe about 10 years ago, there was a very, very small number in terms of, what does that digital strategy look like? Because what I found, it was very piecemeal. So you end up having a digital person here, a digital person there, a digital person there. And I guess there's nothing wrong with that, but it's how do you pull it together in a strategy and have the flexible leaders at the higher end of those teams to really be at the forefront of innovation, transformation, and change, but also have that flexibility to work with team members who are involved in innovation, but others that are involved more in the analytical side, because it takes all types of different personalities and styles to run a digital team. So I think that strategy is really important. Is what are we trying to achieve here as an as an organization, but also stepping outside of ourselves. What do we want to embrace for healthcare communities? Is it access to clinical trial diversity and inclusion? There's lots of things that digital can do to help with that. How can we truly help the HCPs that are facing some of the challenges that you've been talking about? Because I've heard that as well, where CPD hours are being, they have to be maintained, but the time isn't there to do it. So yeah, absolutely.
But this cross-functional
start
approach
with the end in mind, as Stephen Covey says.
Yeah, like the one strategy across functions. I think there's lots of talk and discussion about AI out there and how that can help. But from what I've seen, that's still developing, and it's not going to be a catch-all. It's not going to be the answer to everything. We still got to, as you say, find out what's actually going to make a difference to the customer that you're trying to serve. And I think if that's what you're always sort of got in the back of your mind, no matter what function you're in, then that's a good foundation, really.
Yeah, and it's such a big area. I'm reading things all the time about how, for example, AI and procurement, how that's helping. Obviously you still want the interface of the human translating information, etc. But it's so vast and it's so fastly evolving. You've got to have good suppliers as well who can act as partners to really share, well, this is what's happening in other areas of healthcare. How can we replicate that, and how can we help healthcare professionals and help NHS trusts, for example, across the patch. So yeah.
Well, I think in steps.
Yeah,
I think you've got to do it in steps, because healthcare professions are out there, they're overloaded, they're overworked, they don't really potentially want to pick up something brand new. I think if we can work with them and remain within their existing workflows, and help them share things with their colleagues in a way that they already do, via email or WhatsApp, but in a compliant way, or whatever that is, whatever these sort of methods are, then I think if we start with where they're already at, and apply
this. Yeah, because some people are, I'm quite a big picture thinker, but sometimes it's about starting small, proof of concept type work, and then rolling it out gradually, because it depends how resilient the organization is to change across a number of different measures in terms of resources, people, etc. That's a big factor as well. So in terms of Multimed, Leigh, how do people get in touch with you, or have you got any events, meetings, congresses coming up that you're attending? How do people get in touch with you?
So it's been a big week for us at Multimed, where we went live online, like I was telling you before we came on air. So it's a big week for us. So we're launching our first disease area, which is hemato-oncology. We'll be at the BSH, British Society of Haematology, meeting up in Liverpool at the end of this month. But if anybody's interested in finding out more, just contact me here on LinkedIn. That's probably the best way.
Brilliant. Great.
Pleased to connect.
Yeah. Well, it's been lovely talking to you today, Leigh.
Hopefully much, Sarah.
Soon, and at an HBA event. And congratulations on your launch, and look forward to hearing more.
Take care, Sarah. All the best. Bye.
Thank you. Bye.